I love working with the children. It's such a joy. They come in, they're all wonderful, they all have a lot of things to tell you. You interact, they become your friends, and it's so rewarding. And when you have a child that is a little bit scared and you can make him or her go through the treatment to see the satisfaction they feel that they did it with you, to me it's fantastic. The main difference between a pediatric dentist and a family dentist or an adult dentist is that pediatric dentists are trained on behavior management. We are trained to help the children through the procedure, dealing with their fears, make them comfortable, be sure that they have a good experience. And the second reason is that what we think of as pediatric dentists is the future. We think about growth and development. We think about the way the face will grow in a year from now, in 6 months from now. Whereas an adult dentist deals with something that will not change. The first dental visit should be booked by age 1. And the reason for that is that if you start very, very early, you can do a very good prevention. The first visit is mainly for the parents. It's sitting down with the parents, it's talking to them, it's telling them what to do, what not to do. Obviously, you do examine the child, but the information and exchange of knowledge that goes on between the pediatric dentist and the parents is very important. But there are a couple of things that are very important. Breastfeeding per se, like the bottle per se, does not cause cavities, except that if you put your child to sleep with a bottle, or if you breastfed all the time, then the amount of time the milk is in contact with the teeth, it's too long, and then the chances to get a cavity are much higher. This is my counting. If everything is fine, we like to see children every 6 months. That gives us enough time to see changes, to appreciate the changes in growth and development without missing important signs that something may be wrong. Okay, Matthew, lie down. You see, this is a very good position.
Dr. Corielli has a certain way about her with handling children, and I truly believe that children sense that about her, and that she's warm and comforting, and they just automatically trust her. It's amazing. Children just sense it, and they're just calm and fine.
Inside there with a toothbrush, just like that. I just want to show you a few toothbrushes and toothpaste that may help you to clean your child's teeth. When the baby is really a newborn, what's very good is to use just a simple gauze, and the way you use it, you put around your finger and you just wipe the child's mouth. That's all you have to do. You can put some water over the gauze, that's perfectly fine. Alternatively, there's these baby wipes, they have some xylitol in it that supposedly helps with bacteria. The very same thing, you just open them, put around your finger and swipe the mouth. Once the baby starts to have a few baby teeth, it's a good idea to use a very small toothbrush. It's easy to handle and it makes it easy for you to go and brush the teeth, and don't forget to massage the gums. Even if you don't see any tooth yet, that's where the other teeth will come in, so you want to massage the gums and make teething easier. This is the next step. When the child has more teeth, then you can use a small toothbrush. This toothbrush is made for children. As a small head, it's very soft, it's very easy to reach the back teeth. And then obviously, as the child grows, you will use a bigger toothbrush. But essentially, what you need to do is choose the proper toothbrush, but also make sure that you use it 2 times a day, morning and night, after breakfast, before the child goes to sleep. Children don't always like it, they may fight you, but you still need to brush. It's the most important thing you can do for your child's teeth. Toothpaste. Every toothpaste is ADA approved, is a good toothpaste. There are different flavors, different brands. All you have to make sure is that you use only a pea-sized drop. You want to put on the toothbrush just a very small amount, just like that. So if your child will swallow it, which he will, because children up to age 6 do swallow either all the toothpaste or part of it, you have no issue with ingestion of fluoride. Because you have a very good head control and you can see everything that's going on. How many teeth do you think you have? 4? No way! You don't have 4 teeth. Let's see. Little bit of light. Nice helping. Let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. A big part of our training is psychology is to be able to get a child in a waiting room, has never been to a dentist before and is really scared, and coaching through the visit so that by the time they leave, they're comfortable, they're not scared anymore, so that you kind of prepare them for a lifetime of dental care without fear, which is
Matthew,
huge.
you're a great helper. I wonder which
The main thing they can do, as I told you before, to prevent tooth decay is to give snacks in moderation to the children, make sure that the snacks are healthy food, which is also good for the growth of the body, and brush 2 times a day, in the morning after breakfast and the night time before they go to sleep. And nothing after the nighttime brushing. That's very important.
Okay, Matthew, you're all done. Good job.
You put the token in and we turn it. Now put your hand underneath. Let's see. Oh, we got a pink one. Which other one?
Thank you for watching Parents TV, Our Families, Our Lives.